I was diagnosed with breast cancer in mid-January of 2012 and had a bilateral mastectomy at the end of February this year, that was. And that was followed by expansion and reconstructive surgery. And it took until the middle of June for all of those things to play out, and by the middle of June, I considered myself back to normal. Well, I could recognize that the exercises were targeted to the areas that I was having problems with. You know, raising my arms as high as I could in the past, moving them back, lifting, just mainly arm movement, I guess. And the exercises that you prescribed were certainly all in that arena.
Prior to rehab, had you done or completed any scar massage?
No. Prior to rehab, I pretended that the scars weren't there. I think you knew that.
Yes.
And to myself, I pretended that. And when you explained that scar massage would help alleviate adhesions and would keep the skin more soft and pliable, of course I was in the mode of doing what you told me to do. So you explained to me, you demonstrated to me how to do that. And so I went home, and the first time I tried it myself, total meltdown. Because of the fact that I really hadn't accepted that my breasts were gone, scars were there, and they were never going to go away. And when I shared that experience with you, after it happened, you explained to me that I wasn't the only one that had that kind of reaction. And so that, among other things, made me feel normal in how I was going through the rehabilitation experience. Going to rehab was not only physically rehabilitating for me, but it was emotionally rehabilitating as well. I looked forward to coming a couple times a week just to talk to you about some of the issues I was having and the insecurities that I was feeling too. And thank you for that.
Susan, did you experience the side effect of cording?
I did. And I didn't know what was happening, but cording is a result of the lymphatic system gone haywire, or parts of it gone haywire is what it seemed like to me. And I felt the cording through my arms and down into the trunk of my body. And it was helpful for Kristen to explain that to me, what was really going on. You had explained to me that we needed to break up the cords. And when they did break up, that I would feel that and maybe even hear it. And sure enough, so I found the whole thing fascinating. But it didn't happen right away. It didn't happen overnight. And you gave me a few different exercises to try. When one set of exercises didn't work, the next time I came back, you gave me something different to try. And eventually, we were able to break up all of the cords. So I was appreciative of that, because they did limit my range of motion.
There are multiple theories on what exactly cording is. One theory is that it's an inflammation of the lymphatic vessels. Another theory is that it's the scarring down of the lymphatic vessels. So when Susan was talking about breaking up the cording, she was talking about releasing the scar adhesions of the lymphatic vessel.
You helped me recover my range of motion, my strength. I'm eating better, I'm exercising more, and I feel terrific.